Okay. All right, I'll go ahead and introduce myself. My name is Rebecca Silver. I'm the SVP of Marketing at Let's Get Checked. Really excited to be here for this event. Everyone who is here tonight, thank you for joining us. And just another minute or so and we will kick off. Okay. Welcome everybody who's joining. I am personally calling in from New York City right now, where it is really, really cold. Would love to hear in the chat where you are coming from, where you are tonight. And I'll have our panelists as well introduce themselves, tell us where they are. San Diego, very jealous. Okay, very cool. Montana, Buffalo, great. Michigan, North Carolina, welcome. Okay, I'm gonna start, Louisiana, love it. Keep sharing. Gonna start with kicking it over to Ashley Harrison, who is a nurse practitioner at Let's Get Checked. Ashley, would love to hear more about yourself.
Yeah. Hey, everyone. I'm Ashley Harrison. As Rebecca said, I am a nurse practitioner at Let's Get Checked. We are an at-home testing company, offering over 30 at-home tests. So lots of different tests to choose from. I'm calling in from Atlanta, Georgia. I'm really excited to talk to you guys about thyroid hormones and how to be proactive about your health.
Thank you, Ashley. Nicole, who joined us for our last event and is so wonderful. I'd love to hear more about you.
Thank you. Thanks for having me. So I'm Nicole. I'm a certified women's health coach, and I'm the author of Fix Your Period. I'm so excited to be here to talk about this topic because I feel like, we have a huge amount of women in the world who have thyroid issues, and I feel like there's just a lot to share. So I'm very happy to be here and to be talking about this tonight. And I'm calling in also from the Northeast, where it's very cold. So I feel like we're all in that boat right now on the panel for the most part.
Yes. And Lisha, I'd love to hear where you're coming from and more about you.
Yeah, of course. Hi, everyone. My name is Lisha. I'm a registered dietitian and an integrative and functional practitioner. I've been practicing for almost 8 years now, but it's been the past few years that I've really specialized working with clients who have thyroid problems, but specifically hypothyroidism and Hashimoto's. And part of that reason is because I myself was diagnosed with Hashimoto's and hypothyroidism back in 2017. So with that diagnosis and my own journey, it led me to really want to serve this community, not only learn more to help myself, but start really helping mainly women, but the people who are really struggling to just feel better while living with these different thyroid conditions. And so I'm excited for tonight. I'm calling in from Virginia. It's not normally cold, but we have snow and it has stayed for more than a week, which is a big deal. So I'm ready for it to go away.
I hear you. Okay, we will kick things off. So if you go to the next slide, Caroline, I'll just tell you a bit about Let's Get Checked before we get started. So Let's Get Checked is an at-home solutions company. We offer a wide range of healthcare solutions that you can access right from home, including at-home tests like thyroid tests, which are very relevant for tonight's discussion, as well as sexual health tests, female fertility tests, men's health tests, and tests for a wide range of health conditions, health and wellness conditions. We also offer pharmacy services, so you can access our pharmacy services from home as well as our virtual care services. So our mission is to make healthcare more easily accessible for all. And then if you go to the next one, today we're going to be talking all about thyroid. So we recently kicked off a Let's Talk About series. We just did one recently on female hormones and female fertility, and tonight is all about thyroid. So we're going to be talking about the basics. What is your thyroid gland? How does it work? What is hyperthyroidism, hypothyroidism? What's the difference? What is Hashimoto? So we'll get into all of that. We'll talk about how you spot imbalances with your thyroid. We'll do a little bit of Q&A, true and false, to see how well you know your thyroid, and then we'll talk about what you can do to be proactive with your own thyroid health. We have a special offer for everybody at the end, so stay in there until the end and you'll get that. And then without further ado, we'll hand it over. And I see a question: how do we access previous webinar sessions? You access them on our YouTube channel. We'll also be sending an email after the event with a link so you can watch us on YouTube. And then I would like to, again, encourage participation in the chat. So any questions you have throughout the event, please share them in the chat. Likely someone else will have the same question. So keep the questions coming, and we'll do a Q&A at the end, and we'll try to answer everything by the end. So I will hand it over to Ashley now to talk about what is our thyroid.
Perfect. Thank you, Rebecca. Caroline, if you'll go to the next slide for me. So your thyroid gland is a little butterfly-shaped gland. It sits at the bottom of our throats. It's an endocrine gland, so it's it has bases on our hormones. So the way it works is actually your hypothalamus in your brain secretes a hormone called thyroid-releasing hormone, which goes to your pituitary gland and tells it to release something called thyroid-stimulating hormone, which then goes to our thyroid and tells it to secrete two different hormones, T3 and T4, also known as our thyroid hormones. And these hormones go and work on almost everybody's system. They're extremely important. Caroline, if you'll go to the next slide. So these are some of the hormones we want to make sure that you guys are familiar with before we get started. So first one's the thyroid stimulating hormone, which comes from our pituitary gland. And it's going to go and work on our thyroid gland to tell it to secrete our two thyroid hormones. Our thyroid stimulating hormone is really important. We like to look at it clinically to help us diagnose certain thyroid issues. For instance, if our thyroid hormones are low, so if it's sensing that we're not having enough, our bodies will start secreting more and more TSH to try to increase that thyroid hormone. And so with hypothyroidism, we'll often see an elevated TSH for that reason. Vice versa, when we have hyperthyroidism, you'll often have a low TSH because the body is sensing that there's too much thyroid hormone. So it's trying to stop the thyroid from secreting that hormone. So that's just kind of in general why we look at the TSH. And it's not always the case with hypo and hyper, but for most part, that's what you'll see for that level. The next two, free T3 and free T4, those are our two thyroid hormones. T3 is actually our more potent hormone. It's actually doing the majority of the work of the thyroid hormones. And we'll talk a little bit about the work that they're doing. And then T4 is actually converted to T3 to be biologically active. So our thyroid gland secretes a majority of T4, which a lot of it gets switched to T3, and a little bit of T3. So that T4 is actually switched to T3 in our peripheral tissues, so away from the thyroid gland when they're needed. The next two hormones you'll see are actually antibodies to our thyroid, the thyroid peroxidase antibodies and thyroglobulin antibodies. We'll look at these two to see if you have an autoimmune disorder of the thyroid gland. So Hashimoto, thyroiditis, which Lisha mentioned earlier, and then also Graves' disease, which is a form of hyperthyroidism. Now, there's some people who will have elevated thyroid antibody tests with normal thyroid hormone levels. And that tells us that maybe the person's at increased risk of developing these autoimmune disorders later in life. So just something for us to keep an eye on clinically. Caroline, if you'll go to the next slide for me. So here we'll see just a few of the many functions of our thyroid hormone. First things first, our thyroid hormone helps regulate our metabolism. So what you'll see sometimes in people who have hypothyroidism, their metabolism's a little sluggish, and they'll have difficulty losing weight, or they may be gaining weight quite easily. Alternatively, people with hyperthyroidism, they have a very active metabolism. They're going to maybe lose weight easily, not be able to gain weight. It stimulates our digestive system. So people with thyroid disorders may have diarrhea if you have a more active, hyperactive thyroid. And then people with hypothyroidism often have issues with constipation. It helps with bone maintenance and our bone growth. So it's essential to help close our growth plates as we grow. But it's also very important later in life for just general bone maintenance and preventing fractures. It's essential for brain development. So women who are pregnant, it's so important if they have hypothyroidism for them to not only be taking their thyroid hormones, but also to increase their dosage when they're pregnant to support the growing fetus. But other than just when we're developing in utero, it's also very important for day-to-day brain function, for our mood, for memory, just general not having brain fog and recall, those kinds of things. All our thyroid hormones help with all those things for our brains. Further than that, it also helps with our heart. It helps to increase the contractility of our heart and our heart rate. So, so many different functions of the thyroid. We could go on for a long time, but these are just a couple of the important ones we wanted you guys to be aware of. Thanks.
All right. And next, we're talking about what thyroid disorders are there and the differences between them. So first, we're going to talk about what is hyperthyroidism. So as Ashley just covered, when you're looking at lab work, that's how they determine if your thyroid is overactive or underactive. And with hyperthyroidism, this is a condition where the thyroid is overproducing thyroid hormones. So it's an overactive thyroid. Typically, it happens between ages 20 and 40. And hyperthyroidism can be a little bit more extreme as far as, the condition. It can need more medical treatment and, depending on the case, maybe compared to hypothyroidism. And some of the causes are most commonly Graves' disease, which is an autoimmune disease, radiation exposure, thyroiditis, which is inflammation of the thyroid gland, and pregnancy. I'd probably add to that also postpartum are very common times for the thyroid to be impacted. And up to 60% of individuals are unaware about their condition, which is really important to be aware of the symptoms, which we're going to touch on tonight, but also get the proper testing. So what about hypothyroidism? So hypothyroidism, as you can guess, is an underactive thyroid. This is where the thyroid gland does not produce enough thyroid hormones. And it's really just a term to indicate low thyroid hormones in the body. It usually impacts people between the age, people over the age of 60, but it can happen at any age. And this is really true, especially in the case when we're speaking of autoimmune diseases like Hashimoto's. It doesn't necessarily happen as you get older because autoimmunity can happen at any time. And we're going to actually talk about that next. So some causes: Hashimoto's and iodine deficiency. Oh, can you go back to the, iodine deficiency. Certain medications can actually lower your thyroid function. Some things I would add to this too, if you have had a partial or full thyroidectomy due to cancer treatment or even Graves' treatment or the type of medications, those as well can cause your thyroid to be underactive. And I think I saw a question in the chat about, well, what if it's not caused by autoimmunity? Here are some reasons. I would say less commonly nutrient deficiencies or extreme stress. But if we're speaking of developed areas and developed countries, normally Hashimoto's is what we're going to see. So what is Hashimoto's specifically? Like I said earlier, that's an autoimmune disease where there's an imbalance going on with your immune system. So the immune system is mistakenly attacking another part of your body. And in this case, it is the thyroid gland. This inflammation and damage can cause, over time, your thyroid to be unable to produce the amount of hormones that your body needs to thrive. And as we've said, Hashimoto's is the most common cause of hypothyroidism, where iodine deficiency is not an issue. I believe it's been estimated anywhere between 80 to 90% of cases of hypothyroidism is due to Hashimoto's.
Okay, so how do you spot imbalances? We're going to talk about some symptoms. So we're talking first of all about symptoms of hypothyroidism, and keep in mind that there are more than this. There are also what feel like completely unrelated symptoms, and that's because we have thyroid receptors on pretty much every cell in the body. So we've got an increased sensitivity to cold. So that means that your thyroid is basically slowed down and you are not able to regulate your body temperature in the same way. Dry skin or cracking skin, also cracking heels or dry feet, weight gain, constipation, dry hair or hair that feels like straw, hair loss is another one as well. And then in some cases, an enlarged thyroid gland or a goiter, which is common when there is lack of iodine. Other things to consider too are just like, chronic fatigue or just sort of this bone crushing fatigue that you just can't shake no matter how much you sleep, as well as mood changes like depression and anxiety, things of that nature. And we'll get into the period related problems next. So we can go to the next slide. So symptoms of hyperthyroidism include increased sensitivity to heat. So this is the opposite of hypothyroidism, weight loss instead of weight gain, unexplained weight loss, that is, difficulty sleeping, enlarged thyroid gland as well, that can happen too with hyperthyroidism, heart palpitations, hand tremors. I mentioned the heart palpitations, there's also heart racing, and you can also feel the same symptoms in terms of the mood, like anxiety and I mentioned insomnia as well. But yeah, so this feeling of anxiousness is often what's common with hyperthyroidism. Next slide. I think, oh, is that right? Oh yeah, it is right. Okay, I was looking at this and I was thinking, oh wait, it's not the same slide as what Lisha just had. Okay, so thyroid disorders can affect your menstrual cycle. So too much or too little thyroid hormone can impact ovulation, and ovulation, if it is impacted, it is going to impact what your period looks like ultimately. And it will definitely affect your fertility. So both hypo and hyperthyroidism cause a variety of menstrual cycle related disorders. Typically, hypothyroidism is linked to heavy and long periods, more blood loss, shorter menstrual cycles, meaning like we have maybe a shorter luteal phase or we ovulate earlier in our cycle, irregular cycles, and infrequent periods are often linked to hyperthyroidism, as well as shorter or scanty periods, and even amenorrhea, which is a missing period. So it's really important for us to know that thyroid hormones support pituitary hormone production, as in the pituitary in your brain, and those hormones will influence ovarian function. So they support growth of our ovarian follicles and our production of estrogen and progesterone as well. So when we're in a state of hypothyroidism, because our ovaries have thyroid receptors, when we don't have enough thyroid hormone, it basically is depriving our ovarian follicles of adequate thyroid hormone that they actually need to develop. And this will ultimately impact our ovarian production of hormones, particularly progesterone. And the other thing to consider too is that without adequate thyroid hormone, to make a healthy dominant follicle for when we're about to ovulate, we will potentially experience these, like I was saying, heavier periods, PMS, irregular periods, and fertility problems. The other thing with hypothyroidism to keep in mind too is that it kind of diminishes the body's sensitivity to insulin, which is one reason thyroid disease is actually associated with polycystic ovary syndrome, and it can worsen cases of PCOS. Hypothyroidism also reduces sex hormone binding globulin. So this is a protein, and it binds estrogen and testosterone in the body. So it will, if SHBG is reduced, we might end up with higher estrogen, higher testosterone. This could lead to heavier periods in some cases. And then on the other side of that, hyperthyroidism is kind of the opposite. So it can increase SHBG. And so this could lead to less estrogen, lighter periods, missing periods. there are also a few other ways as well that the thyroid can impact the menstrual cycle. When I mentioned this before, but progesterone is a big player in thyroid function. So if we don't have enough progesterone because we're not ovulating, we have a problem making thyroid hormone. And then if there's not enough thyroid hormone, we have a problem making enough progesterone. So there's a whole cycle happening. And I think that, the more we know that everything is interconnected in our bodies, the more we can put pieces together if we are struggling with an issue. Okay, next cycle, or slide, not cycle. Okay. All right, so how well do you know your thyroid? So we've just been talking about all this stuff. Let's get into the different questions. So is the thyroid located at the base of your neck? Everyone can just respond in the chat box if that's true or false, or yes or no. All right. Looks like everybody's been paying attention. Amazing. Okay. All right. Is the thyroid part of the respiratory system? Okay. I feel like, yeah, people are on there too. Okay, great. And then does the thyroid produce and store a variety of hormones? Question number 3. Okay. Good job. All right. Everybody's so smart on this call. Okay, great. So let's talk a little bit about how stress impacts the thyroid. I feel like, we're all pretty stressed these days, and it's not just stress in our lives, it's sort of stress throughout the world, and it's a lot, and it puts a big burden on our HPA axis, which is the hypothalamic pituitary adrenal axis. So this is the axis in our body that manages our stress response. There's also there's a HPT axis for the thyroid and an HPG axis, that's the gonads or the ovaries. So think of these axes as all playing together nicely in the sandbox, hopefully. And so what happens typically is we have this ongoing psychological stress or physical stress, and this will cause problems for the HPA axis, which can then lead to the thyroid being affected. And how it does this is, like I said, we have these axes, they're all talking to each other. So when cortisol levels rise, this actually has a direct effect on the thyroid and the production of thyroid stimulating hormone, or TSH, decreases in proportion to the increase in cortisol. And so essentially what's happening is cortisol is going up and it's kind of suppressing the brain's production or the pituitary's production of TSH. And this will in turn decrease the conversion of T4 to T3, which is the more active form of this hormone in the body, and increases reverse T3 levels. And reverse T3 is actually produced during times of long-term stress or illness. And so we have the situation where higher stress will basically just be down regulating our thyroid function, which is obviously not ideal. And we will potentially start to see a response from our thyroid. In addition to this too, cortisol also raises blood sugar, and this can lead to elevated blood sugar, insulin dysregulation, insulin resistance even. And insulin resistance has been found to be damaging to the thyroid cells and possibly even worsen Hashimoto's or Graves' disease. So this is something too that we have to think about as being a big impact on our thyroid. And then on the other side of that, low cortisol actually can increase our susceptibility to autoimmune and inflammatory diseases such as Hashimoto's or Graves'. So there's both sides to that whole cortisol conversation. And I think one of the bigger problems is that most of the time we're only testing TSH and T4, which tend to remain normal during these initial stages of thyroid dysfunction. And so that's obviously why I'm always recommending the Let's Get Checked thyroid testing. So yes, that's kind of what's happening with stress. And usually with the stressor, if it goes away, or if we move out of that state of chronic stress, typically the thyroid will regulate. And so it's not so much a thyroid problem, it's a problem of the HPA axis impacting the thyroid axis. Okay, we can go on to the next slide. Okay, perimenopause. All right, so perimenopause is another one. I feel like this is a big conversation. So the symptoms of perimenopause and thyroid problems are very similar. Changes in our estrogen and progesterone during perimenopause can impact our thyroid hormone levels. I just mentioned progesterone and thyroid and their wonderful relationship. And so what's frustrating is that it all kind of looks the same, right? So the best way that we want to do this is to talk about testing. So I just mentioned, these symptoms that are associated with the different thyroid disorders. There's definitely overlap between thyroid and perimenopause symptoms. For perimenopause, typically we're looking at things like weight gain, especially abdominal weight gain, fatigue, heavy periods or missing periods or irregular cycles. We see hot flashes, we see insomnia, we see anxiety and other mood issues come up, practically identical to a lot of the thyroid symptoms that we were just talking about. The other thing to keep in mind too is that during this time in our menstrual life cycle, estrogen and progesterone are changing quite a bit. So those are now going to impact the hormone levels that, the thyroid hormone levels. So basically, a lot of practitioners will actually refer to this time in a woman's life as thyropause because of the drop in those sex hormones, estrogen and progesterone can trigger a thyroid condition. So there are a few things happening. The first is we're losing progesterone in perimenopause because we're no longer ovulating as consistently as we were in our 20s and 30s. And so ovulation is now slowing down. It causes this downregulation of the thyroid function. Like I was just talking about, there's this intricate connection. And ultimately, thyroid hormone production sort of starts to take a back seat. The other thing I just talked about too is this insulin resistance. And it can be really common in perimenopause because of the decline of progesterone and estrogen. Those two hormones are kind of like a blood sugar buffer. They actually have insulin sensitizing effects in the body. So when we start to lose them in perimenopause, we start to run into problems. And as I was just saying, insulin resistance can actually be a problem for the thyroid. It can cause damage to the thyroid cells, and then the thyroid doesn't work as well. So ultimately, there are a number of different things happening with perimenopause. I won't keep going because I could go all night with this stuff, but it's just good to know that if you do have a thyroid condition or you suspect you have a thyroid condition and you're starting to experiencing these symptoms, yes, it could potentially be the effects of perimenopause, but remember that everything in the body is connected. All these axes are talking to each other. So you really do want to get testing. And I just mentioned LetsGetChecked, thyroid tests that are available. Those are a great place to start. As well as, I know you have other tests as well for female hormones too, which also are a good place to start and try and figure out what's going on with your health.
Perfect. So thank you, Nicole. So some great ways, like she said, to be proactive about your health. Carolina, if you'll go next. So just looking out for some signs that we've discussed for hormonal imbalances, whether it be the irregular periods, changes in your weight, or sensitivity to heat or cold. Anything like that, we encourage you to get tested. And I will say, if you notice that you do have an enlarged thyroid gland, you feel a nodule or anything like that, I would encourage you to see a healthcare provider in person to get that looked at. For hyperthyroidism, there is different treatments. There's medications you can take. There's radioactive iodine treatments. There's also surgery, I think, as Lisha mentioned, where they can actually remove parts of the thyroid gland. And then for hypothyroidism, there's medications we can give. The most common one is called levothyroxine, which is actually T4. It's a synthetic form of T4. And so that's a very common medication you'll see for that. But it always helps to know your levels. Even if you aren't having symptoms, you have a family history, it's something you're interested in, it never hurts to check. So on the next slide, you'll see we have at LetsGetChecked 2 different thyroid hormone tests. One is just our thyroid test, which includes our TSH, T3, and T4. And then we have a thyroid plus test, which actually includes those antibodies, the thyroid antibodies. So can take a look at both of those. But as Nicole mentioned, we also have some great hormone tests at LetsGetChecked. So some of the ones we offer is one for PCOS, which takes a look at some of the hormones that might be affected if you have PCOS. Also have a general female hormone test, which is good for women to get a better look at their hormones as it may impact their fertility status. and then also have a test for progesterone to determine if you've ovulated. So lots of great tests if you're interested in getting a better look at your hormone health. And you'll see at the bottom of the screen there's a little code there where you can get 30% off all of our thyroid and women's health tests.
Great. Thank you, everyone. That was so interesting. We're going to do a Q&A now. And I also just want to mention, I think the link in the beginning was not working. So if you know anybody who wanted to come and wasn't able to, we are sending out a recording of this event by email, but hopefully most people were able to come. Okay, some really great questions here. I'm going to start with, we got a lot of questions about stress. Nicole, this one is for you. Can stress alone cause a thyroid disorder, or does there have to be an underlying component?
I think that I think first of all, the definition of stress is so vague and broad. So that's something to think about when you're considering what could be the cause of whatever's happening with your thyroid. There's obviously external psychological stress. It's a big problem for many of us, but there's also internal stressors too, right? So like I said, high blood sugar is an internal stressor. It creates this inflammatory state in our bodies. There's also other things too, heavy metals, mold toxicity. There's lots of issues, gut related problems that can be stressors. So just keep in mind that these are all sort of risk factors for thyroid issues. But yeah, like ongoing psychological stress absolutely can downregulate your thyroid. It doesn't mean that you have a thyroid disorder, like I say, necessarily, although you may, but it does set you up for thyroid dysfunction for sure. And so really getting a hold of the stress in your life and like really implementing stress mitigating techniques or tactics or strategies can be very, very helpful for your thyroid.
Thank you. Lisha, this one is for you. What foods or diet do you recommend for someone with a thyroid condition? What should we avoid or seek out?
Sure. Yeah, that's a really common question that I get from clients or people on social media. First, I want to say that if you ask your doctor this question, you will likely get a very different response. And to that, I want to say I would recommend seeking out someone who is trained in nutrition specifically. And also, it's not as common to find dietitians who specialize in thyroid health. That's something that, the individual would have to take upon themselves to really focus on. And so working with a professional would help to figure out your unique intolerances. And that seems to be really common, at least what I've seen with Hashimoto's autoimmunity. The inflammation aspect is certain foods can cause symptoms to be worse, can exacerbate inflammation. And I like to say everyone is unique. So I do agree that you should cater the diet for what works for you. But with that being said, the most common question I get is, can I eat gluten with Hashimoto's? Can I eat dairy? And there is a good amount of research to support that gluten can cause more inflammation or worsen Hashimoto's specifically. Now, if we're talking just about hypothyroidism, possibly not, but Hashimoto's does have a correlation with celiac disease. So that's something else too. If you have Hashimoto's and suspect something's going on, it's not a bad idea to rule out celiac and vice versa. So gluten is one that I usually tell people, if you've never tried to go gluten-free, it never hurts to see how your unique body is going to respond. It's hard to be dogmatic about things because we're all so different. But I usually say, give it a go. You might be surprised that you feel better. Maybe certain symptoms resolve, perhaps not. But if you do need help in that area, seek out a professional, have them help you and take that burden off of trying to figure it out all on your own, because it can be a big change to make. But gluten and dairy tend to be big triggers for Hashimoto's. I've seen it personally and within my practice as well. So those are two that you can always start with and then customize further, probably by working with a professional.
Thank you. We also got a question about herbs or natural treatment. Is there anything you'd recommend there?
Is that for me too?
Yeah, that's for you too.
Yeah. So herbal support, adaptogens are a very common question I get. They can be. I don't want people to use that as a Band-Aid, however. Yes, they can be helpful to mitigate the stress response, help in times of stress. But if you're not really focusing on how you personally manage stress or what's causing the stress, then it's not going to solve that underlying issue. So sometimes I'll use them depending on the situation and what someone's going through, and they can be a useful tool, but they're definitely not a cure-all at the same time, but they can absolutely be part of a comprehensive treatment. And there's so many different types of adaptogens out there, and there's different blends. So again, working with someone who is familiar and can help direct you in the right way is better than saying like, this is the best or that's the best for everyone, because we're all different.
Thank you. Ashley, this one is for you. We have a number of comments about how, sometimes tests come back normal. If your THS and T4 are normal, or you're told that there's nothing wrong. Are there other tests to take, or what would you recommend if someone has all of the symptoms or some of the symptoms, but is not getting that diagnosis?
Sure. Yeah. I mean, from a clinical medical standpoint, in terms of treating hypothyroidism, we do only treat it if your TSH is a certain level and your T4 look a certain way, and if you have certain symptoms. It's not recommended to treat hypothyroidism with prescribed medications if your thyroid hormone is normal. Now, as Nicole was saying, with that said, obviously there's certain things like trying to decrease stressors, trying to eat a healthy diet, things that you can do that might help mitigate some of those symptoms. But also maybe looking for further than your thyroid, look how your other hormones look, your estrogen, progesterone, those kinds of things that can also impact your mood, whatever your symptoms may be. So there's a lot of other problems that might be going on. But to truly diagnose hypothyroidism, if your tests are normal, then, you don't technically have that issue.
Thank you. And can you tell us more about the medications that are prescribed, like the most commonly prescribed medications for thyroid disorders?
Sure. Yeah. So the most common for hypothyroidism is called levothyroxine. It's actually a synthetic form of T4. It's typically dosed based on your weight, but also based on your history and your age. There's another medication that's actually a synthetic form of T3. We don't use that quite as often. Usually endocrinologists will prescribe that, more specialized people, but it is a little more potent of a medication. It's harder to dose. And then for hyperthyroidism, there's two different oral medications you can take that help to kind of decrease the activity of the thyroid gland. There's also treatments, radioactive iodine treatments, where you actually take the radioactive iodine and it helps to kind of damage the tissue, the thyroid tissue. So as Lisha was saying, sometimes people who do take some of these medications for hyperthyroid actually will end up in a hypothyroid state and have to be on levothyroxine to help to give them some of that thyroid hormone. And then one of the less common treatments for hyperthyroidism is actually surgical intervention. So it's all depending on really what your history is. Hyperthyroidism is more of a complex, a little more complex to treat than hypo. So for hypothyroidism, primary care, a lot of different primary care practitioners will help treat that. But with hyper, it's usually an endocrinologist who will manage that for you, just because of the complexities of it.
Got it. Thank you. Nicole, this is for you. Will supplementing with glandular adrenaline hormones help during times of stress? You're on mute.
Sorry about that. I am really careful with supplementing with glandulars. I feel like that's a very individualized or it requires an individualized approach. So yes, potentially, but I would definitely work with someone if you're going to do that.
Thank you. And then we got a few other questions about stress. Even the pressure of having to relax can be another thing that causes stress when you're going through thyroid issues. Do you have any recommendations on how to manage that?
Yeah, I mean, I think the first thing to consider with the thyroid is, and I'm sure that everyone here can chime in on this too, is that, if there's something going on with your thyroid, there's likely something happening somewhere else in your body, right? So we were talking about the external stressors, we're talking about your gut health and what's happening with your liver and your blood sugar and stuff. So I feel like a foundational approach is really important for anyone who's dealing. I mean, I'm reading through all of your comments here, and clearly a lot of you are really struggling. And this foundational approach, I think, is so critical. I mean, I want everyone to really check in with themselves and ask yourself, are you eating consistently? Are you eating 3 meals a day? Are you, not waiting until you're absolutely starving to eat? Are you drinking enough water? Are you actually getting enough sleep at night? Are you waking up feeling rested? Are you exercising? There's a lot of, like I said, low-hanging fruit foundational pieces that a lot of us aren't doing. And then we're looking to all these supplements and everything else, when in fact, we need to address those pieces of the puzzle that are what is going to make the thyroid function optimally. Like our thyroid is our body's temperature regulator. It's a regulator of our metabolism. If it's not getting the nutrients that it needs, vitamin D, all of the minerals like magnesium, zinc, selenium, iodine, which we were talking about, iron. If we're not getting that, or if the thyroid isn't getting that, it's not going to work properly. So I think a lot of us have to come back to the foundational pieces and really start to think about, what it is that we need to fill in those holes. And then once you do that and you're still having thyroid problems, then you start to look to more advanced therapies. But ultimately, like we've been talking about, if you're under a great deal of stress, like if there's anything in your life that or any practices that you can bring into your life to help mitigate the effects of that stress, because those effects are far reaching, as I was talking about, I highly recommend you start there. Start with just getting enough food into your body every day. A lot of us are, like I said, skipping meals or, eating, not eating until like 1 o'clock in the afternoon, or skipping breakfast. That's not necessarily working for you. And I really encourage everyone to use their symptoms as a roadmap to what's going on in their body, rather than just thinking like, oh, there's all these symptoms and I don't know, they're all disconnected. I don't really know what's going on. And instead, know that it's your body just talking to you, and start to pay attention, track the symptoms, see where they show up as it relates to your menstrual cycle, and then start to, make additional changes. But start with getting enough calories in and stabilizing your blood sugar with protein, fats, and, and healthy carbohydrates. I would definitely start there as a basic.
Thank you so much. And it's really nice to see everyone sharing in the chat their own stories and starting this community together. It's really great to see. And I know, Lisha, you have your own story, and I'd love for you to share more about that if you're comfortable doing so.
Yeah, I would be happy to. This really just highlights the importance of getting regular checking, a lab test done if you sense that something is off with your body. And we all know our body's best. Don't let anyone tell you otherwise. If you feel like something's off, go to your doctor, run some tests, explain what you're experiencing. And like Nicole said, like document and track how you feel and keep an eye on that. So I was diagnosed in 2017. And it was during a routine checkup, and my antibodies were through the roof. My TSH was 42.6. So for anyone who understands lab ranges, that's pretty darn high. It's supposed to not be between, 0.5 and 4. And my other thyroid markers were very low, and it had been going on for a very long time. And it's not that I was oblivious of my symptoms. It's that I think sometimes as women in particular, we like to unintentionally attribute them to being busy, just being stressed, and we push it off, and we don't necessarily think that something is wrong, or it's normal to have these symptoms. And at the time I was busy in college with an internship and multiple jobs. And I just thought I didn't know how to handle stress. And it was harder to lose weight, but it wasn't a big deal. And then once I got the diagnosis, it was kind of a light bulb moment that my body had been crying out for help for a really long time. And it was a hard pill to swallow, I would say, because, I thought I was a dietitian at the time. I thought I was living the healthiest lifestyle, but I'm glad I had that diagnosis, because it was a huge wake up call that I really needed to learn how to better take care of my own body and really figure out why I have the symptoms and how I could resolve them. So getting the proper medical treatment was huge, but, for myself, what was also very, very important was lifestyle adjustments. So like Nicole was saying, like managing my stress and taking responsibility for that, doing the right type of movement for my body, sleeping more, like actually going to bed before 10 o'clock and not like after midnight. And then nutrition was a huge piece as far as gut health, because that's a big area that can cause inflammation for people. So it was definitely a multifaceted approach. It took time. And like I said at the beginning, that's really what pushed me to want to specialize and help people with their nutrition and lifestyle changes to support their thyroid and their Hashimoto, so they can feel better, because medication is important and we need to make sure we're getting the right amount of hormones, but also like your lifestyle and what you do day to day is equally as important. Because many people still have symptoms despite being medicated. And that's a really important thing to not ignore. So that's kind of like my background. I like sharing it because I think there's many people who are similar. Some people kind of have the opposite, where they know something's wrong, but it's taken a really long time to get the diagnosis because the proper markers weren't checked. For example, both antibodies should be screened to confirm Hashimoto's, or an ultrasound to back up that diagnosis. So be an advocate for yourself, find a practitioner who is willing to run a complete panel. Let's Get Checked. I use that a lot with my clients just because it's so convenient. But my primary who diagnosed me, she just started with the TSH. When it came back at 42, she had to investigate and she had to check the other markers because it was so obvious. But obviously, if I knew then what I know now, I wouldn't have probably let it get to that point. But yeah, I feel better now being 30 than I did at 20, if that says anything. So how you live and what you eat and the medical treatment you get makes, a world of a difference.
Thank you. Thank you so much for sharing. There's so many great questions that are in the chat. And if it's not answered tonight, please email us at support@letsgetchecked.com. Also see a question about whether we prescribe medication. We actually we just launched our pharmacy offering and we are launching a specific care pathway for thyroid within the next couple months. So we'll be prescribing medication for that in addition to regular testing and virtual support. So stay tuned for that. And I know all of you have been looking at the chat, and if there's anything you want to address or jump in, would love to hear from the panelists.
I have one thing I wanted to say about, sorry, Nicole.
No. I was actually just going to say thank you so much for sharing your story, because I feel like it gives people hope, right? That there's actually a lot that we can do without having to go down like the major medical intervention route right away. So thank you. I appreciate that.
Oh yeah, my pleasure.
Yeah.
If I can help someone, that's what I'm here for. So I saw in the chat, someone was asking about iodine and what foods it's in. And that's something I think that is really important to speak about in regards to Hashimoto's, because worldwide iodine deficiency is the leading cause for hypothyroidism, but in places where that's not a problem, with Hashimoto's, you do have to be really careful about your iodine intake, because too little or too much can actually make the problem worse. So sometimes I see thyroid supplements or certain resources recommending like lots and lots of iodine, but that can actually exacerbate the inflammation and cause more of immune system imbalance, at least towards the thyroid. So I would stay away from supplements that have, high amounts of iodine. Typically what's recommended is what is contained in your multivitamin, which is about 150 micrograms, unless you're pregnant or breastfeeding, that's different. But as far as foods, like the sea vegetables are very high in iodine. I would also be careful. Iodized salt is obviously very high in iodine, but other foods that contain iodine are your seafood, dairy and eggs do contain iodine. So just be aware that if something is good, more is not necessarily better. And I think that's a message that happens a lot with nutrition. Like one thing's good, so more and more and more is definitely better. And that's not always the case.
So true. I was actually going to say, I should have prefaced that for everyone and said, like, don't go out and supplement with iodine without getting a diagnosis and really understanding, how all of these nutrients work together. So absolutely, like what you said, I think the food-based approach is obviously the way to go for the most part. And then supplementing with the help of an expert is your next step.
Thank you. Saw a question come in. Is levothyroxine a lifelong medication? once you start taking it? Ashley?
Hey, yeah. So it is intended to be taken lifelong, to help manage your hypothyroidism. So yes, it's intended to be daily medication. If you are on it, I would highly recommend, don't stop it without telling your physician or your nurse practitioner, or whoever prescribes it. Make sure that they're aware so that they can be checking everything very diligently.
Thank you.
I was going to say real quick, I just wanted to speak to what Maria said about it's hard to do self-care because energy can be so depleted, and which, I think is very relatable for so many of us. And self-care can possibly be more subtle and with less movement when exhausted. And totally, you know what? I think self-care is a little bit harder than just like a bubble bath, for instance. I think it's about boundaries, about having boundaries around your energy and what you're capable of doing. And I think that's hard for a lot of us ladies. And, because we're programmed to overgive and overprovide and just take care of everybody. And I think that has been to many of our detriments. And so I really encourage everyone to rethink their version of self-care and what that looks like, and think about your energy levels, what you are capable of, be really realistic about your time constraints or how much time you actually have for things in your life, and really, and start to have hard boundaries around this stuff, because it's only going to get worse as you get older. I think back to when I was in my 20s and early 30s, and I'm like, what was I even doing then? I was so not busy, but I was so busy. I was constantly doing something. And now it's even crazier. So I really think that it's important for us personally to really develop strong boundaries around, what we are capable of, and asking for help. We don't do that well either. And when you have a thyroid problem that's impacting your entire body and your energy levels, you really want to be focused on how can I do less and get more out of life, and asking for help, delegating, having boundaries around what you say yes and no to, are just some really crucial aspects of it.
Thank you. I love people sharing how they set their own boundaries in the chat. That's great. Just a couple.
My mother. Sorry. Yes. It takes all kinds. Yeah, absolutely.
Just a couple more questions before we wrap up. Does Hashimoto's cause a hoarse sounding voice if left untreated?
It can. It can be one of the symptoms of Hashimoto's, but I do encourage you to discuss that in person with the provider, because they may want to end up doing a thyroid exam or even imaging just to make sure there's no nodules or goiter or anything. But yeah, it certainly can cause a hoarse voice.
And can low thyroid cause a goiter?
Goiter, yes, it can. A hyper and hypo can both cause the thyroid to enlarge.
Okay. Everyone's getting in their last minute questions. This is great. If anything wasn't answered, that's a burning question. Ask it now. Can your thyroid cause high blood pressure and bad migraines?
I would think so. Yeah, I feel like it's all, it's kind of all connected. So, if there's high blood pressure, there's potentially something else going on that's causing the high blood pressure and causing the thyroid problems. I mean, that's usually adrenal related with the high blood pressure. The sodium potassium regulation, and our adrenals do that. So I would say that. And if your adrenals are wiped out, Kara, you can tell us what's going on with your stress and what's happening with your adrenals. It's likely having an impact on your thyroid and causing the high blood pressure. The migraines, again, it's a combination of things. It depends on when the migraines happen in your cycle, because it could be cycle related. But if you're having migraines, there's, likely underlying inflammation. It's all connected, and there's multiple causes potentially. It's not necessarily the thyroid's causing those things. It might be those things are linked to the thyroid.
Thank you. A couple of questions about pregnancy. Is pregnancy possible after a thyroidectomy due to cancer? We had a few questions throughout about the effect on pregnancy as well. For Nicole, you as well.
Oh, I don't really know, to be completely honest. I mean, yes, it is possible after a thyroidectomy, as far as I understand, because you're supposed to be put on thyroid hormones. I'm sure you ladies can also chime in on this. So yeah, I would say that it is. You want to be working with a practitioner who's really skilled in this and able to measure those hormone levels consistently. But yeah, and I would love to hear you guys' responses about pregnancy and stuff too, because I feel like that's a big one too. I feel as if you have a thyroid problem, you want to be monitoring your thyroid hormone levels throughout pregnancy, because it's a cause of miscarriage for sure. So it's something that I think really we should be focused on diligently if we have a thyroid problem or suspect one, because remember, thyroid is connected to progesterone. If we have low progesterone, it's another massive cause of miscarriage.
Thank you. Ashley, we have a question about a thyroid ultrasound. What should you be looking out for and expect when you're getting that?
So usually a thyroid ultrasound is ordered if you have like an enlarged thyroid, or if your practitioner actually feels a nodule or something like that. Ultrasounds, it's just like a little one that you'll get it like in a radiology department, but they'll actually take a picture of the thyroid gland to see if there's any nodules, enlargement, or anything going on there.
Thank you. Okay, we're just going to do two more and then wrap. Can thyroid dysfunction affect eye health? And is there anything else that we haven't talked about that it might affect? I'll ask Ashley or whoever wants to jump in on that.
Yeah, I can. We've all seen, I think, the commercials now for thyroid eye disease. So that's where it's exophthalmos, where the kind of the bulging eyes. And the reason people with hyperthyroidism are usually the people who get that issue. And it's from your thyroid hormone. The inflammation actually starts impacting the muscles of your eyes. And so they kind of start bulging, but it can also cause issues like redness or dry eyes or pain in the eyes. So yeah, it certainly is linked to your eye health.
And then last question, can you tell us more about how to interpret the results of a Let's Get Checked thyroid test and what the different levels mean?
Sure. So our nurses in our app, everything does go over this in detail when you get your results, and our nurses are always available to answer questions you may have. But the TSH is, if it's elevated or low, we're looking to see, if it's elevated, that could maybe be an indication of hypothyroidism. Low, maybe an indication of hyperthyroidism. And then T3 and T4, same thing. If they're low, that could be linked to hypothyroidism. High, linked to hyperthyroidism. And then I saw in the chat, actually, someone asked about if their antibodies are positive, if they have autoimmune thyroiditis. If your levels, like your TSH, T3, and T4 are completely normal, but your antibodies are positive, that means that maybe you don't have autoimmune disease right now, but it means that you could develop Hashimoto or Graves' disease later in life. So it's something that you certainly want to keep a close eye on. As Lisha said, had she known that she had these positive antibodies, her physician or she could have had more close look at her thyroid gland and be looking at it more regularly and kind of track those symptoms more. So it doesn't mean that you're actually diagnosed with it until that TSH, T3, and T4 are out.
Thank you.
Yeah.
All right, we're almost at the hour. So many good questions and comments in the chat. I want to mention that there we go. We shared it. If you would like to participate in an event, share your own story in any form by, just social media, email, anonymously or not, we'd love to hear from you. My story at LetsGetChecked.com. And then there was a question about continuing the conversation. We would love to do that and just start a community to have these conversations in an ongoing way. If you RSVP'd for the event, we have your email, but if you did not send us your email if you want to participate in that type of community. And we'll be following up with more information, including the event link if you missed any of this event or want to share it with anybody you know. So stay tuned for that. And if there's anything else or any closing words, I'll hand it over to the panelists for final words.
Thank you all so much for listening. We're all very passionate about thyroid disease, as you can tell. I personally have a strong family history, so it's something that I certainly like to keep an eye on. So I'm glad we could hopefully help you guys educate you a little bit more on hypothyroidism, and knowing the importance of getting checked. So thank you all for listening.
Thank you, everyone. Thank you. Your questions were all amazing, and hopefully this has been helpful.
Thank you so much to all of our panelists. It was so informative and educational. Thank you so much. And look out for our email. We'll be following up soon, and we'll definitely do more events and build out this community so we can continue to share our stories and ask questions and talk about this. Thank you, everyone. Have a great evening.
Thank you.
Bye.